Tune in to any hospital TV show, and you'd think emergency rooms are constantly bringing people back from the brink. But that kind of excitement is more about ratings than real life.
We know when you watch ER on TV or other shows, everything is really acute and emergent. And I think when we look at our patients, most ERs don't have that high level of acuity and emergency. So we might have 1 or 2% of our patients per year that need a full-blown resuscitation. But we have to be ready for that any time of day or night for any cause, whether it's a trauma cause, whether it's a medical cause, whether it's a cardiac cause, a drowning, or anything else. We have to be ready for that.
So Ronnie, we're in the ED. Airlift has just transferred her over. She's already on monitor. She's got a working IV.
Ready for anything at any time. That's why training, and lots of it, is so important.
Patient weighs 12.5 kilograms and has no drug allergies.
Teams run scenarios complete with role-playing, sometimes with scripts to follow, to fine-tune communication.
So we just did a scenario, which in our terms is simulation. That's practice. We're practicing. It's an opportunity for us to work on skills and on communication challenges that we face every day. And it's a chance for us to work on them and practice them over and over again so our skills get better and our processes run smoother.
Can I get a doctor in here?
Some simulation training is so realistic, it's hard to tell it isn't the real thing.
Total of 10 milligrams, is that correct?
Correct.
As this team tries to deal with a resuscitation drill, a technician makes the sim baby's breathing, blood pressure, and heartbeat react as a real baby's might.
So Sarah, after you've gotten the intubation meds ready, then we'll start a bolus.
The sats are still dropping and I'm struggling to ventilate.
The staff at Seattle Children's are national leaders in developing and implementing simulation training like this.
So right now they're getting ready to intubate the patient. They're going to be giving rapid sequence medications.
So this is epinephrine, 1.1 milligrams.
They set the standard for how providers across the country train and prepare.
Let's stop the scenario.
With practice, this kind of emergency becomes routine, even though it's relatively rare, as appropriate and immediate response can be life-saving.
And it's probably similar to what pilots do. You know, they practice and they practice and they practice, so when they have an emergency, it's second nature. And one of the most important things in the emergency department is to anticipate and be prepared.